What is QT interval? What are normal limits? Why it is so important? This is discussed in this video. The QT interval is the time between the beginning of the QRS complex and the end of the T wave. It represents the time required for the ventricular depolarization and repolarization. The QT interval is usually measured in lead 2 or alternatively in leads 1 in V5 or other lead with high T wave. It may be difficult to define the end of the T wave because the last one may gradually merge with the isoline or the U wave may be merged with the T wave. There are two methods to define it: the maximum slope intercept method, the tangent method, and the threshold method. End of the T wave is determined by the point at which the T wave merges with the isoelectric baseline. The maximum slope intercept method is preferred in most cases. The QT interval changes with heart rate. Faster heart rate leads to a shortening of the QT interval. Slower heart rate causes lengthening of the QT interval. The QT interval can be corrected for a heart rate using many formulas. Bazette's formula is the most commonly used. The QT interval is divided by the square root of the RR interval in the seconds. It may overestimate the QT interval at a high heart rate. A prolonged QTc interval is of great clinical significance. Congenital long QT syndrome is a rare inherited disease caused by genetic abnormalities. Electrolyte abnormalities such as hypokalemia, hypomagnesemia, and hypocalcemia may cause prolongation of the QT interval. Many medications may cause QT interval prolongation. They include antiarrhythmics, such as amiodarone, sotalol, antidepressants, such as citalopram, acetylopram, bupropion, mianserin, amitriptyline, imipramine, doxepin, nortriptyline, antipsychotics, such as haloperidol, droperidol, olanzapine, quetiapine, chlorpromazine, antimalarial drugs, such as chloroquine, hydroxychloroquine, antibiotics, such as macrolides, fluoroquinolones, antihistamines, such as estimazole, loratadine. Other causes of prolonged QT interval include myocardial ischemia and raised intracranial pressure. It may be found after cardiac arrest. Normally, the QTc interval ranges from 350 milliseconds to 440 milliseconds in men and from 350 milliseconds to 460 milliseconds in women. Prolonged QTc interval more than 500 milliseconds is associated with a specific type of polymorphic ventricular tachycardia called torsade de pointes. Generally, two drugs causing prolongation of the QT interval should not be prescribed simultaneously. But if it's necessary, a thorough monitoring of the QT interval is performed. Short QTc interval, that is less than 350 milliseconds, may be caused by hypercalcemia and digoxin intake. Congenital short QT syndrome is an inherited cardiac channelopathy associated with a sudden cardiac death mainly due to ventricular fibrillation.
Thank you for watching this video. We hope you enjoyed it. If you want to see more of our videos, please subscribe and hit the like button.